Welcome, everyone, to another episode of the Power Panel. Today, we will be talking about the psychology of metabolic health, why mindset matters in obesity care. So, before we dive into our exciting topic, I wanted to mention that today's Power Panel is brought to you by Myos MD, the cutting edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortitropin, a natural bioactive compound clinically shown to enhance muscle growth and reduce antibiotic resistance, MyosMD is changing the way we think about muscle health. If you'd like to learn more, you can go to myosmd.com. All right, well, to today's episode, we'd like to welcome our guest today. If you don't mind giving a little background on yourself and your clinical training.
Hi, yeah, sure. I am Dr. Franchell Hamilton. I'm board certified in both obesity medicine and general surgery, and then I did a fellowship in bariatric surgery. So the majority of my career has been only strictly in obesity care. I've done other stuff like on call, like in the hospital, but um, I am founder of NeuroSwitch Weight Loss, formerly known as A Better Way. We had multiple centers in the Texas area. We've since, after COVID, have gone virtual. And so that now has become an educational platform for both patients struggling with obesity and for them and their family members and providers who want to practice obesity. And so I talk a lot about genetics and brain-based weight loss on those platforms.
Okay, amazing. And so I've heard that you've often said that curiosity is the best weight loss mechanism. So can you explain what you mean by that and how curiosity really does play a role in patient success?
Yeah, definitely. That's kind of like my bread and butter epiphany that I came to probably about 7 years into treating bariatric. I started off just doing surgical weight loss, and then after the weight regain and all the stuff, I started adding these other certifications, functional health, and obesity medicine, and actually published a book about curiosity is the best weight loss medicine. Because what I found in my patients is that and one of the things that kept them going, the ones that were successful, because I studied the ones that were successful and didn't regain, they had this like natural like curiosity to them, to where they were like, what can I do next? How can I keep going? They didn't just reach their like weight loss goal after surgery and then stop, which is sometimes what a lot of people do. They're like, oh, I made it. You know what I'm saying? I'm kind of done. They kept like making tweaks, kept being iterative, and kept just like, what else can I do to stay here? And even though now I'm at my goal, like what other diet changes can I do, lifestyle changes to make this a sustainable? So that's where I kind of coined curiosity. It's really a brain-based mechanism, and people who harness that for their weight loss journey and habit change, I feel like have sustainable results.
Amazing. And so, on that note, in your clinical practice, what would you say are some of the most overlooked psychological or even behavioral barriers to lasting weight loss, especially after bariatric surgery?
So I noticed the biggest, believe it or not, people are really concerned about regaining their weight. Um, and so it's almost this oxymoron, because they're the biggest thing is I don't want to regain my weight, but then some of the habits and stuff that come back, they end up regaining the weight, and then it becomes like this cycle where they just, you know what I'm saying, kind of goes down. And so it's almost like the give up mentality. Like they feel like they're doing stuff and working so hard, and they just get tired. And so one old habit creeps in, which turns into 10 old habits that creep in. And then before they know it, they're just kind of bouncing back to some of their old habits without even realizing that, which is why I think the biggest thing is creating new habits and figuring out a way that works best for that person. And it's very individualized. Like, I just can't give you a prescriptive, do low carb for the rest of your life, because that won't necessarily work. And so it's like, how can we incorporate these small habits into your existing habits, the small, better, healthier habits, to where this becomes sustainable for you?
So, how do you coach patients to reprogram or start new habits that can contribute to, not gaining weight in the
Yeah.
future?
That's a good question. So I do a lot of the stuff, and honestly, I personally do a lot of this. I have kind of a natural curiosity, and genetically, I always tell my patients, I am like my patient. I have cardiovascular disease in my family history, obesity, disease, diabetes. And so in order for me to prevent those, I'm constantly like, what else can I do? And it's always small. So some of the things, for example, I was stuck on Diet Coke, like personally. Being in surgery residency, we worked a bunch of hours. And so Diet Coke and Mountain Dew. And so I had to like figure out, and I do this with my patients, why did I want that Diet Coke or Mountain Dew? Is it the caffeine? Is it the carbonation? Is it the sweetness? And then once you can pinpoint like what that thing is in the brain that your body wants or craves, you need to substitute that for a healthier option. Um, and so for me, it was obviously mostly the caffeine, not so much the carbonation. And so I found other better ways to get the caffeine. Like I can do certain teas, or you know what I'm saying? And so I do this with my patients if they're hooked on soda or whatever it is. What is it that you want out of that? And then let's hold on to that and then find a healthier option. And it becomes much easier than telling somebody to give up their soda for life. Well, how about if you want something carbonated, let's do carbonated water for some of the sweetness, if that is what you're after. And it is much easier for people to kind of give up the older habit and start a new one. And I call those neuro switches, like brain switches. We're not giving up something without giving something back. So that's how we do it.
Yeah, I love that perspective. And even like when I used to see patients, like so many of them used to say they didn't like water. And it's like, okay, let's make it fancy water. Like let's put cucumber in it. Let's put strawberries in it, whatever's in season. So yeah, there are so many different swaps that, it seems like such a big hurdle, but they can be such simple switches or neuro switches. Yeah.
Yeah, exactly.
And then, so can you talk about neuroplasticity and how that factors into helping patients create sustainable change?
Yeah, so a lot of that I don't take credit for some of this brain work. I kind of piggybacked on a lot of addiction medicine, because I was seeing a lot of those same patterns in both bariatric and obesity patients in general, even if it was obesity medicine, where they had these certain addictions. And when fMRI studies were done, both on addiction patients and then even some on patients' cravings, like they have these centers in the brain that kind of light up. And so when I studied and noticed, because I have a background in psychology, that people in addiction medicine were able to kind of change the way people's brains responded to certain cues through this work, I was like, well, then this can happen with sugar cravings, or you know what I'm saying? Some of these eating disorders, some of these other things that people kind of struggle with even after, bariatric surgery. Believe it or not, even though we give you a surgery, like those inherent cravings and habits actually don't go away. We just kind of change some things metabolically, but a lot of people still have some of their cravings or some of the unhealthy eating disorders even, or habits. And so they came up with the idea that brains can change even after somebody's been set in the ways. They've seen new neurons become created. They've seen on fMRI studies changes in the brain after coaching to certain things, and new patterns develop. So when I say neuroplasticity, and a lot of my patients are excited to know that their brains can change, because a lot of people just feel defeated and it's like, I can't do it. Like I've been doing this for so long, or I've been overweight for so long. And I'm like, you can do it. Like there's studies, there's imaging showing that the brain has the ability to change. At one point, a long time ago in dinosaur years, we thought it was just kids who had this ability to like grow and learn new things. And then come to find out everybody can do it. They've just got to kind of stick with it and keep going.
Yeah, that's so empowering. Yeah.
Yeah.
So I wanted to switch gears a little bit and talk about the recent, boom in GLP-1 medications, and especially the growing use for them in people who are interested in managing their weight. So, from your perspective as a bariatric surgeon and someone who's been involved in metabolic health, what role do these drugs play, and what's your perspective on them?
So I think these are very powerful and useful medications. There's always kind of a big whoop going on right now, like who can make them and who should take them. But I will say they've been great in the obesity space. A lot of people are scared of getting a weight loss surgery. They're like it's a permanent change to their body, which it is, and so not everybody wants to undergo that. They always want to know what else are my options. And I think GLP-1 is a really good option. They, I think, are stronger than some of the older we call anti-obesity medications that we've had in the past. They are definitely seeing weight loss numbers on the same scale of surgery for some people. I use a lot of GLP-1s. It has definitely decreased when they came out my bariatric practice, I'll be honest, because a lot of people prefer to do GLP-1s over surgery, and they were losing over in a year's time. Some people were losing up to 100 pounds, which is the equivalent of some of the surgeries out there, depending on the patient. And so I have also noticed, though, they don't always work for everyone. So kind of when the big push came out, everybody thought they could take them and lose these large numbers, and then quickly became disappointed whenever they didn't lose these large numbers in a month, or you know what I'm saying? And so I definitely think they need to be monitored more. I think there's more than just taking the GLP-1. I think obviously genetics play a role because not everybody responds to the GLP-1s, but metabolically, it has worked really well for insulin resistance. If taken the right way, it has decreased that and obviously has helped with weight loss, fat loss, and in inflammation. It's been a really strong, what I've noticed, anti-inflammatory agent. So a lot of people who have autoimmune diseases or just joint pain, they saw relief by taking these medications, and hence, therefore, they feel better and then they can do more. But one of the biggest downfalls we have seen, and this came out in one of our obesity conferences I was at last year, and I started telling my patients the muscle mass loss, which I'm sure you and your company know better, just as good as anybody else, providing these prescribing these GLP-1s. One of the studies that came out is, skeletal muscle mass loss is also in our heart. And so a lot of people are increasing heart age on these medications, who are mostly the ones who are not working out. So again, like any weight loss journey, you can't just take a medication. You know what I'm saying? You have to do all of the things. And so a lot of people taking the medications, if they were not working out in a year's time, they added like 10 years onto their heart age. And so, there are downsides. So it just needs to be monitored while people are on medication.
Absolutely. And you already started talking about it, but would love to talk about it a little bit more. So, how do you approach muscle retention and strength in patients as they're in their weight loss journey?
Yeah, so I will tell you, in the weight loss journey, this has been one of the most difficult because, I mean, it happened with bariatric surgery also, that patients, some of them are very resistant to working out. Like they're okay with doing the diet piece for the most part. They're okay with giving up kind of some of the junk food. When I say diet, I mean that. I don't like diets in general, but giving up some of the junk food, giving up some of the sweet drinks. Most people are okay with that, and it's easier to do either after surgery or with medication. But getting people sometimes, if they weren't already working out has been probably one of the most difficult for me. Some patients do it, but some patients, they don't have the drive or the motivation. And so the biggest thing I would tell patients on these medications is weight resistance. That was more important. And people who, I'm like, walk up a hill if you don't want to pick up weights, and it doesn't have to look like weights. It could. I would tell them it can be Pilates, it could be yoga, it could be body training and strengthening. But that was one of kind of the biggest hurdles, is to get them to do weight resistance. But studies have shown that if they can add that, it will help with some of the muscle mass loss, which can be significant because that is your metabolism, right? Like your muscle mass is your metabolism. And as that goes, so does your metabolism. And now there's supplements for sure that can also help combat that. And I don't mind patients taking supplements. I still want them to do the weight resistance. I would prefer if they did both. And then we could probably hold on to all of the muscle mass. So I'm curious kind of what you guys see and what you think on that also.
Yeah, I mean, I can speak from my personal experience or professional experience that I really like the perspective on whole person integrative care. And I think supplements can be a part of the discussion, but supplements can't answer all the questions, just like prescription medications or surgeries also can't answer all the questions. And so it has to be this multifaceted approach. And so as much as I think, going through like a bariatric surgery and then supplementing that with, supplements, prescription medications, altering your diet, it needs to be all of those things. And especially when I used to work with patients, it's like starting so small. There are patients who, don't really walk more than a few hundred steps a day. And so let's start with like walking around the block, especially this time of year. Let's start with, and then each week just increasing just a little bit. Walk 5 minutes more, or maybe the weather's not so great. Maybe it's raining outside. Let's think about a treadmill or an elliptical, but just starting so small and growing bit by bit, because we're doing this for the longevity. We're not doing this for like a short-term fix. And so if we think about it in a stepwise way, I think that patients are a bit more open to just doing just that little bit and changing things slowly.
Yeah. Yeah. And I totally agree. I do that a lot because I've noticed in training, actually. I mean, I was a fellow, so I didn't say much in my obesity training, but giving patients this like laundry list of things they need to do is
So
overwhelming. And then patients wouldn't say anything because it's the, you know what I'm saying? This is the doctor. But in my head, I'm like, this is overwhelming. Like, so some in part of fellowship was learning what not to do. I would never do that. Like, start with something small. Like, I literally had an attending do a burpee, and it was like, this is what you need to do at home. And I'm like, do you see the walker over there? You know what I'm saying? Like, why are you doing a burpee in the office? Right? He's not going to be able to do this anyways. And so I totally agree with like small steps, and you know what I'm saying? And I will say it's come a long way since I probably about 20 years ago when I was in training. And I'm super excited because patients have awoken also. A lot of the ones that I see are like, I know it can't just be meds. I know it can't just be a quick fix. I really hope we're past all that gimmicky stuff now, like from years and years of like diet culture, like that clearly doesn't work. And that not only providers, I think, know this, but patients are also like, I'm hoping, because a lot of my patients were at this point were like, yeah, I know it has to be like all of the things, you know what I'm saying? And so that was a conversation. I noticed that conversation I'm having, it becomes less and less with my patient. Like, it's not just about meds or it's not just about surgery. Like, I think they're kind of waking up to that after like decades and decades of this diet culture, quick fix advertising. Yeah.
Definitely. And as you are talking to patients, what kind of support systems or interventions do you think have been the most effective for patients post-surgery or post-weight loss to prevent, the weight gain?
Well, I feel like regular visits with someone has been very helpful. I noticed the people who did the best regularly follow up. And so we can catch things or talk about things that they didn't even realize. You may have something that's kind of slipping in that they didn't even realize they were doing. Like, all of a sudden I gained 5 pounds and they've been steady. And I'm like, okay, well, what's going on? And we find out it may be work related, or they're traveling more, they're not sleeping as much. And then they're like, oh, I didn't think about that. So whether it's a health coach, a nutritionist, the physician, having people that they interact with regularly. And in my practice, we have physician extenders. You know what I'm saying? My patients would see me, somebody in the office, anywhere from every 3 to 6 weeks. We typically, so whether it was monthly, if they needed more help, you know what I'm saying, We didn't really go much further than that. I feel like the people who just get the surgery or just do the medication and then kind of, oh, I'm losing weight, and they don't see anybody for 6 months, those people I don't think do as well. It's very much a journey, and you need somebody, a team working beside you, a personal trainer, a nutritionist, pretty regularly to get you through this journey and to help you create those new habits. So I think that's been the biggest thing, accountability, and then showing up regularly with all members of the team for that integrated care.
I'm so glad you brought up the, cross collaborative team or interdisciplinary team, because I think in particular with something like weight loss, that is so important, bringing all the different, specialists and experts together.
Yeah, I agree. And I've even had physical therapists help me with patients because they've had mobility issues. And so it's not just, they may not be able to go see a personal trainer. Fine. Let's go see a physical therapist to kind of work on mobility even. That's better than just being stiff and doing nothing. So it really does take a whole, you know what I'm saying, a whole team. Yeah.
Yes. And so how do you think healthcare providers can better integrate mindset and behavior change into their standard metabolic or obesity care? And I'm thinking about this question from like key takeaways as we're closing out the session.
Yeah, and a couple of things. So I did a webinar with Obesity Medicine Association in regard to this. So I think we can, just for some resources, that's a good resource. And in NeuroSwitch, my website has several good resources, because this is actually very important to me, because I'm just one doctor. I only can see so many patients, like we all get full, and so one of my biggest things that I do now is educate other providers, because it's almost like we're better in numbers, and then being able to educate patients and moving away from the prescriptive. So one of the things I want them to move away from the prescriptive, do this diet, do this exercise. Like we as providers know what the guidelines say, right? The exercise 150 minutes, you know what I'm saying? Like moderate to severe. Keep the patient in mind. Most people can't do that. You know what I'm saying? So I hardly ever ask them to do that. Especially in the first several months, most of them were just trying to get to move, or to, you know what I'm saying, do kind of small steps. So I would say that's one of them, move away from the prescriptive diet and exercise regimens, keep the patient in mind. And two, I would start working with them on substitutes, meeting them where they are. So for example, when I assess a patient, I kind of in my head and in my note make a list of some of their what I call unhealthy habits, right? I don't want to say bad. So one of the things we need to do is phrasing and reframe how we talk. But I'll do unhealthy habits, and it may be lack of sleep, it may be late night snacking, like all of these different things. And I ask the patient just to pick one thing that they think they can improve, and then I share my input. So my conversations with the patient is very much shared goals. I'm not like feeding them. I am giving them my expertise, and this is what's affecting your weight loss. What do you think you can do? I can give up late night snacking. And like, okay, great. And if you have a late night snack, then how about we do these options instead? You know what I'm saying? So that's kind of so reframing and switching things, and then I would say the other big thing is not just taking everything away from the patient, like I call it like a deprivation diet. I don't think those ever work. Again, and that's part of meeting the patient where they are. Like I don't think you should just say, oh, you can't have this anymore, or stop the cake, or completely stop the alcohol. I think having conversations with the patient, helping them understand some of these habits, and then meeting them where they are and figuring out how you can do like something in between, instead of just like doing it like a deprivation, like a total stop doing these things. So those are the things that I would say. There's so many, but that's where I would probably start.
Yeah, I definitely agree. And in integrative medicine, we call that patient-centered shared decision making. And so it's like, okay, this patient provider relationship is so important, but how can we think about our efforts as a team and understand, what's going to work for the patient, but also what's going to work for the provider. And at the end of the day, like what's going to get the best outcomes.
Yeah.
And instead of deprivation, I always like to think about it like, how can we add things? So it's like, oh, maybe they're not eating a lot of vegetables. And so like, let's think about, okay, maybe tomorrow you try a red vegetable and then the next day you do an orange vegetable. And just like experiment and try other things. And you might find out that you really like kohlrabi, but you really don't like carrots. And both of these things are fine. And so like, how can we add more things that you maybe haven't tried or that you haven't experimented with? Yeah.
And I like that you use that term because that's where curiosity comes in, right? Like the experimental mindset. I guess it'd be like just like that, an experimental mindset where that's exactly what you're doing it. You're using curiosity. And it's funny because for whoever has kids, I do the same thing with my kids to like try to get them. So it's nothing like new. I'm doing the same thing in my own home that I would do for my, you know what I'm saying, do for my patients. So I love that idea of experimenting. And that's what keeps people going, right? Like, and they find new things that they like that they didn't even know they like. So you just kind of wrapped it up with probably what my whole like speech and spill is just using the curiosity, just keep them experimenting, make it fun, and I think it becomes more sustainable that way.
Absolutely. So as we wrap up, we'd like to thank Dr. Hamilton for being our guest today and to Myos MD for sponsoring today's Power Panel. Fueled by the revolutionary proprietary ingredient Fortitropin, Myos MD is trusted by healthcare providers nationwide to deliver real results backed by science. So if you'd like to learn more or hear more from experts like ones today, we have those on our YouTube channel as well as on myosmd.com. All right, where can people learn more about you, Dr. Hamilton?
Yeah, so they can find everything they need to know on my website, switch weightloss.com. All one word. It's long, but it's all there.
Okay, amazing. Well, thank you so much for all of your insights today. And if anyone has any questions about Myos MD or about learning more about NeuroSwitch, you know who to reach out to. All righty. Well, thank you so much and have a great rest of the week.
Thank you.
All righty. Bye-bye.
Bye.